And why is this class important today? This particular class we're going to do, why is it important? You realize that isolation precautions, okay, falls under safety and infection control. And this accounts for about 10 to 16% of the cases you will meet on the actual NCLEX exam. So that means 1 out of every 10 questions you will meet will focus on safety and infection control. And that is why it is important that you take time to appreciate this particular topic. The reason why we are focusing on this class is because 1 out of every 10 questions you meet in the NCLEX will focus on safety and infection control. And this falls under your safe and effective care environment category. So that is something you want to pay attention to. So look, we are diving right into isolation precautions right away. Isolation precautions. So let's go. Now, what are isolation precautions? Somebody may ask, what are isolation precautions and why is it important that we learn about it? You realize that isolation precautions, these are methods we use to prevent the transmission of infectious diseases. So I'm just going to highlight that for you. So in case someone asks you, you go to the ward, or you are practicing and someone asks you, what are isolation precautions? Isolation precautions are methods that we use to prevent the transmission of infectious diseases. Why is it important? Why is learning about isolation precautions important? You realize that it is critical to protect both the healthcare workers, everybody, nursing team, physicians, laboratory team, including, even visitors and the patients from infections. So you are protecting the nursing team, you're protecting the healthcare workers. At the same time, you're also protecting the patients from infections. Now, the NCLEX focus here is this: understanding when to apply isolation precautions based on the type of disease or infection. So today, by the time we are done with this class, you have to know that, okay, if I have a patient with meningitis, what kind of isolation precautions am I going to apply? If I have a patient with, say, tuberculosis, what kind of infection prevention and isolation precautions am I going to apply? And the key point we want you to understand is that you've got to also understand these two things. We have what we call standard precautions, and we also have transmission-based precautions. Let me say it again. We have standard precautions, and we also have transmission-based precautions. So you've got to identify which diseases require specific isolation precautions and which situations are you going to apply standard precautions. So let's start with standard precautions. Okay, so please, what were the two types of isolation precautions I was talking about? I want you to type your answers. I talked about two things right now. I want to see your answers. So someone says standard precautions. Beautiful. I'm looking for the second one. What was the second one I told you about? Two ways or two, precautions we take to prevent disease transmission between healthcare workers and the clients. We've learned about standard precautions and transmission based precautions. So please learn those two things. So I'll just put a different highlight on it so you can be able to pick it up well. Standard precautions, transmission-based precautions. Two things. So please remember, standard, transmission-based. Okay, what is standard precautions? For standard precautions, it applies to all patients, regardless of their infection status. So whether the patient has tuberculosis, whether the patient has meningitis, whether the patient has COVID-19, no matter the medical condition the patient has, standard precautions applies to all patients. Remember the word standard. Okay, standard precautions. And what are these standard precautions which apply to all patient categories and all infections? What are these standard precautions? Number one, hand hygiene. Okay, hand hygiene. Even that one, everybody knows that hand hygiene is, standard. When you enter the hospital, wash your hands. When you leave the hospital, wash your hands. Before you touch a patient, wash your hands. After you touch the patient, wash your hand. Standard precaution. Another standard precaution is for us to know that we need to know the need for the use of gloves when we are handling body fluids like blood, like urine, like CSF, cerebrospinal fluid. So we are going through all the various standard precautions. Number three, mask and eye protection. When you are dealing with a case where there is a risk of splashes, and if it splashes, it can get into your eye. So that is another standard precaution you want to know. Number four, the use of gowns when it is likely that you can be soiled. So we've learned hand hygiene, the use of gloves when handling body fluids, mask and eye protection, gowns when soiling is likely to occur, and proper handling of sharps to prevent injuries. So, for example, if you are working with a physician and that physician has to do some procedures, okay, as soon as that procedure is done, all the sharps must be taken away. All the sharps must be taken away. Okay, so handling of sharps, gowns when there is soiling likely, mask and eye protection when there is the likelihood of splashing, okay, use of gloves when you are handling all body fluids, and hand hygiene. So these are your standard precautions. So the tip I want you to go home with standard precautions is very simple. And this is the tip. I'm going to highlight it so that we all get it right. Standard precautions should be the default protocol for all patient care, including situations with unknown infections. So, with all patient care, make sure you've washed your hand. With all patient care, so far as there's body fluid you'll be exposed to, make sure you use gloves. Okay, this is the NCLEX tip for standard precautions. So, hand hygiene. Let's take our time and talk about hand hygiene under standard precautions. If there is any precaution for isolation precaution and for infection prevention, which is the most important, the most critical action you need to know is hand hygiene. Hand hygiene. Now, there are two common ways we keep hand hygiene. Number one is to wash the hands with soap and water, and number two is to use hand rub or alcohol-based rub. Now, for your NCLEX, you need to know when to do hand washing with soap and water and when to use alcohol-based rubs. Now, if your hand is visibly soiled with whatever, then make sure to use soap and water. Or if you are caring for a client with Clostridium difficile, please make sure you are using soap and water. Now, when it comes to alcohol hand rubs, what is the indication? When do you use alcohol hand rubs? You use alcohol hand rubs when there aren't visible soiling of the hand. So, when will I use soap and water? When my hands are visibly soiled, or when I'm dealing with a client who has C. difficile. When am I going to use alcohol hand rub? When my hands aren't visibly soiled. So, the tip I want you to go with today, I'm going to highlight that tip for you. Is this. I'm highlighting it. Ensure you know when to use soap and water versus when you're going to use alcohol-based hand rubs. So I have a question. I'm going to move the slide. When are you going to use soap and water? And when are you going to use alcohol rubs on the hand? So what's the indication? Okay, so Her Excellency Mezu says, when your hands are visibly soiled. So I'm sure she's talking about the use of soap and water. And what was the other indication for the use of soap and water? Like in terms of precautions, we said when the hands are visibly soiled, and something else. We said something else. So we said if the patient has Clostridium difficile, you want to always use soap and water. Now, when are you going to use alcohol hand rub? Alcohol hand rub, alcohol hand rub. When are you going to use that? When are you going to use alcohol hand rub? I want to know. Alcohol hand rub. When are you going to use that? So we learned that we'll use alcohol hand rub if the hand is not visibly soiled. Okay, all right. So now, what about personal protective equipment, PPE? I remember during the COVID period, it was a big thing. Everybody was talking about PPE. Now, PPE, personal protective equipment, protects healthcare workers and patients from exposure to infectious materials. Okay. Now, what are the types of PPEs? We have gloves, and we learned that we use gloves whenever we have to touch body fluids. We have gowns. We learned that gowns are used when contamination of the clothing you are wearing is anticipated. And we have masks and goggles. They are used for procedures likely to generate splashes. Okay, so you've got to know which PPE to use depending on the type of isolation precaution you are dealing with. So if someone asks you, what kind of PPE will you use if there's likely to be splashes, you need to know. If someone asks you, what kind of PPE will you use if there's likely, if you're going to touch body fluid, you need to know. So I'm just giving you another picture of that's the glove, that's the PPE. Okay, the mask, you know, the gown you wear, and then if you look closely, the glove as well is under the clothes. Now,